Thanks so much for tuning in to Talk Erie and the Joel Natale Show, live from our Kingdom Financial Group studio here at 5th and State, also live on Facebook and YouTube. And we want to welcome in our studio here, Brandy Alexander. She's the Community Impact Manager for the American Heart Association here in Erie. Brandy, welcome. Thanks so much.
Hi, thank you so much for having me today.
You know, we're a family show. We like to hear origin stories. You said you're from Erie. Tell us how you came up, where'd you go to school, and so on.
Yes, so I'm born and raised here. I actually went to Harding Elementary.
Yeah.
And then for high school, I went to formerly known as Central Career and Technical School, now Erie High.
Yeah.
And then when I graduated, I had a focus at Central for medical assisting. And then once I graduated, I went to Slippery Rock, and I focused for my bachelor's and master's in public health.
Oh, wow.
Yeah, I graduated like during the pandemic. So coming back home, I've been working in Erie ever since.
Really? Okay. Yes. And have you been seen that you were able to kind of slip into this role as community manager?
Yes. So after graduating and staying in Erie, every position I've had some relationship with the community, which was nice, you know, growing up here and seeing how Erie has evolved. Now being an adult, I'm able to kind of play hand into how I can help Erie evolve even more. So I've had a background with recovery addiction. So I did Hep C, HIV outreach work. I've also worked with refugee-based healthcare, and then tobacco vaping, policy-based healthcare, and then now at American Heart Association, I cover a lot of entities. I can kind of get into that a little bit more, but being a community impact manager, we focus on policy, system, and environmental changes in community and clinical settings.
All right. Explain what that means.
Yeah,
you know,
I can get into that. So a little bit more about like core pillars of health that pertains to being a community impact manager. We look at access to care. Obviously, we want to preserve and expand Medicaid coverage and increase American Care Act enrollment. We also look at the quality of care. So we want to improve care in clinics, hospitals, post-acute facilities. We also discuss Nation of Lifesavers, so improving the bystander effect, which we can talk a little bit more being Heart Month.
Wow.
And then the health factors, right? So the goals that I have being a community impact manager, obviously we want to control blood pressure, improve nutrition security, and e-cigarette tobacco use. Yeah. So, and then we also, again, we want to target community-based organizations, faith-based organizations, anywhere where people kind of come together, even if it's after work, before work, and when they go to their doctor's appointments. We want to see them where they are and be able to improve their care.
Do you think that overall the general public doesn't know what they don't know about heart health?
I think it's a little bit of both. Obviously, we want people to have a great relationship with their PCP, their providers, be able to trust their providers. Being into this role, I'm learning that trust is a huge aspect when it comes into relationships with their providers. So being able to rely on them and make those appointments, follow through with those appointments is really huge. So I think it's more so of just also acceptance can kind of play a role in that too. Like some people can be in denial about their health, and then once they get the news like, hey, you know, you may need to take some medication, or you may have to have a change of healthy lifestyles. So I think it's more so of just grasping that we have control over our health, and you know, being able to utilize what's accessible in anyone's community. But yeah, I think everything kind of plays a role into it. I think it just depends on the person and what they want for themselves.
I feel like there's, you have the situation where you have people that know that maybe they're not acting, you know, in the healthiest way. You know, I'm thinking of a smoker. Again, I don't want to, you know, disparage smokers, but most smokers know that probably this habit is not the healthiest thing for them to do.
Right.
But then there's the other side of people that just, you know, it's like they just are, like you say, they're in denial. So they don't go for their annual checkup. They don't know what their blood work says, right? I mean, I mean, these are all things that
all
are
factors
pretty
that play a
critical,
role.
aren't
Yeah,
they?
Yeah. So a part of being American Heart Association, that's why, especially in this new role that I have being in Erie, and then I also cover 19 counties. So that kind of goes into play about the access to care. So getting closer, or I want to say, reaching out to people that are like in the rural populations, that they kind of have more resources than they probably assume, versus urban areas. So like Erie, you'll probably see a UPMC or Allegheny Health Network or a clinic, a free clinic, anything like that within so many miles of one another. And then once we look at the rural areas, it may not be as close as it is here. So we want them to, people who live in those rural areas, to understand that we're also trying to work for them to help them out as well, because that's a huge barrier, right? There's tons of barriers when it comes to healthcare, but someone like me in my role, we're trying to eliminate those barriers.
Yeah, and also there's this whole education piece of saying, okay, don't just kind of ignore
The signs.
signs, right?
Yes. So we actually have a youth engagement aspect when it comes to being at American Heart Association. So we have people here at American Heart that go into schools to also educate students right where they are, and give them resources so that they know that it starts at that age, right? And then they can even bring that information at home and then educate their parents and their family members on ways to be healthy, getting adequate sleep, don't use tobacco or e-cigarettes, healthy eating, things like that. So, American Heart, we're trying to target all populations. And I'm really excited to be here and be a part of American Heart Association.
All right. So let's get to some of the kind of the big, there's some big events that we like to talk about. And maybe you can share what those are and what's coming up here.
Yes. So on Saturday, May 17th is our Erie Heart Ball. This is a ticketed event, but you can contact Gina Kloft, and I have her email. It will be capital G, period, capital R, period, capital KLOFFT @heart.org. If you're interested in learning any more. And then later on in the year, September 18th, is our Erie Heart Walk. Everyone is invited to participate in this free community event that will be held at Liberty Park. And there's more information regarding that on heart.org. I can provide you with the link sometime.
Okay, awesome. And again, this is American Heart Month, in February here. And it seems like the focus nationally is for children. Now, this is a statistic that I did not know. Did you know that more than 23,000 children experience cardiac arrest outside of the hospital each year? And so they're encouraging folks to learn CPR.
Yes.
I mean, so basically everybody should know CPR.
Yes, we want everyone to know CPR. Hands-only CPR is also crucial. There is a fact that some people may assume that with CPR and breaths is more effective, but hands-only CPR is just as effective for somebody who needs that life-saving measure. So some statistics that I found is that the average EMS response time, at least in Erie County, is 8 minutes. So compared to other counties, that's relatively good, but at the same time, we still want people to practice hands-only CPR, just in case, you know what I mean? Like, it's great for everybody to be, proactive in the sense of improving the chances of survival. So I've done a class of hands-only CPR, and we actually have a couple kits. I wish I would have brought one. It's actually at home, but it's amazing to see individuals learn to do CPR and see, how their actions can benefit someone's life.
So, is it? I mean, when you're performing CPR on a child, what are the big differences?
Right.
'Cause I know with the infants, you just use a couple
two
fingers.
Yep,
right?
the two fingers, and then obviously with children and adults, you want to have one hand out, and then you have another hand over, kind of like intertwining your fingers.
Okay.
And then you're able to put your hands on their chest, and then you'll see the not the machine, but the dummy that we use,
Right,
or
yeah.
the model that we use. There's a click noise, and obviously that is replicating the sound of you being able to do those compressions on someone's rib cage.
Is it more pressure than you think, or less?
It's when I say you really, because I have experience working at a hospital like setting,
Yeah.
and you have to break someone's rib cage. So it is an intense feeling of having to do those compressions and using your body weight to do that. But again, it's life-saving measures. So in the moment, we want someone to call 911 doing those compressions. I've noticed, like, watching certain videos online, that somebody could get caught in the moment. So I feel like calling 911 also helps with staying on track on the repeatedness of doing compressions, the momentum, right? There's songs that we actually have a Spotify playlist, and it actually has music that you could listen to that will keep you on beat while doing compressions.
Now, I remember when we had Gina here last year, she said, it used to be that we sang Staying Alive, right?
Yeah.
That was the Bee Gees, but nobody knows the Bee Gees anymore. So
Well,
isn't there like a Taylor Swift song or something?
There is a couple songs. I'm just now, because I follow American Heart on Instagram, and on the Instagram post after the Super Bowl, they actually have Kendrick Lamar's song, Not Like Us. Actually, one of the songs, I think it's 163 beats per minute.
Wow.
Yeah. So if you ever want to follow us, on American Heart on Instagram, they actually will post a few songs. But if you want the actual playlist, I do believe it is on Spotify. I don't know about Apple Music, but I know for sure it's on Spotify.
Yeah, and again, just to be able to be able to hit that.
I was telling the class that I was just at a couple days ago, when we do a follow-up class, pick a song to bring to the following class, and then let's see, the compressions with their favorite choice, and then see if that's a good song, because they could probably tell someone else, hey, a good song to do compressions is this song, this Taylor Swift song. But no, it's incredible how we're able to work with individuals and get them comfortable to the idea of, even though this could be your loved one, a child, a parent, a spouse, a sibling, that you're still able to realize in that moment that you are performing life-saving measures.
I want you to weigh in on, what, like, I always heard that using an AED really advanced the survival rate of somebody in cardiac arrest, right?
Yes. So a little bit with my position that we would like to do is implement AED. So do you guys actually have an AED here?
Not in the building.
Not in the building.
And I hate to say this, I don't know where the nearest one is. I'm assuming it's at the food hall.
Okay.
But I need to confirm that.
Yeah.
But it's that kind of
information,
being aware of your surroundings, right?
Yes. I hate to say there is an app, and I know it off the top of my head, and I can probably look for it on my computer, but there is an app that you can download, and I believe it will get you in touch with, like, the nearest AED.
Really?
Yeah, if I can find it, I can look for it sometime, while I'm here, and I'll be able to share that with you. But yeah, it will be able to let you know the nearest AED, but then also communication's important. So the Children's Museum actually has an AED.
That makes sense.
Yes, I worked with them before, so I know that they have one. But I'm pretty sure, being in downtown Erie, that you should have a few. But if not, hey, this is something that we could possibly discuss after today about AED and hands-only CPR with the building here. So I'd be more than happy to talk about that.
Let's go to our break here. We have Brandy with us. She's Brandy Alexander with the American Heart Association, Community Impact Manager. Stay with us. It's Talk Erie. Talk Erie and the Joel Natale Show. We are live from our Kingdom Financial Group studio here. Brandy Alexander is with us from the American Heart Association. It's Heart Health Month. And Brandy, we were talking off air about, this idea of not everybody understands their own personal health and their risk factors and things. And, the Heart Month really gives us an opportunity to kind of circle back and say, okay, what do I need to be concerned about? And so one of the things that really totally surprises me is just people walking around with undiagnosed hypertension. Mm-hmm. I mean, have you encountered that kind of thing?
Well, yes, personally. Oh, I'm so sorry. Yeah. Personally, in my life, yes, with family members and friends, and then also in my role here at American Heart Association, that some people don't know the accurate levels of what a normal blood pressure is, what it is to be hypertensive, and then what to do about it. Some people feel as though that they can live with having hypertension and not taking medications, or possibly, not changing, having that lifestyle modification. So that's where that education piece comes in, and we're able to tell them, you can do the healthy lifestyle changes with medication, working with your PCP, following up with those appointments. But it's something to see being at my age and then knowing that it's affecting all ages, right? My older relatives may assume that it only occurs with them, but I mean, hypertension can happen at any age, as a heart attack can happen at any age, right?
They're saying that like teenagers are getting high blood pressure. That's tough, man.
Yes. So with that tobacco vaping use, we see a lot of health effects, especially because now with these vapes, we're getting that data. Not the same kind of way we got with cigarettes, because cigarettes has been around for so long versus these new vapes, and they're coming out with new products every day. In my opinion, I do think that the education with teenagers hits a little bit harder, because they assume, well, how do you know? We're learning just like you guys are. And it's like, well, yes, but we're also understanding that nicotine is addictive chemical. And with your brain not being developed until the age of 25, it's harder on your bodies. And we want you to not pick up these devices, pick up, cigarettes, but at the same time understanding that you're vulnerable at this age. So why, put anything into your body that's addictive? So teenagers, it's a fun population to work with. But, it's also rewarding to see them make good decisions for themselves and their friends.
Do you think that teenagers and young adults, the 18 to 25-year-old, are they getting their screenings?
Yes, and then no. I
guess your mom could force you.
I was just 25 a couple years ago.
But did you have how do you build those good habits of, I got to see my doc once a year?
Right. So for me, it was kind of watching my mother. She took me to her appointments growing up as a child, and then obviously forcing me to go to the pediatrician to get those vaccines that I hated getting. But it's education you get anywhere. So that's why it's really important for our staff to go into the schools, because if they're not seeing it at home and they're coming to school every day, they could hear their friends talking about going to their appointments. So, they see it on TV. So there's exposure somewhere, but we just have to figure out if it's the right exposure, because some people could see on TV or online how these people that they look up to on social media are using these products and they have no effects. And then we have to explain to them, that's just a 10-second clip of somebody's life. We really don't know what other health effects are going on. Wow. So, how impressionable teenagers are. We want to educate them on, not picking up these, the tobacco, the vaping, the e-cigarettes. And then if they are using it, refer them to the right places so that they can get cessation efforts and to quit.
Talk about other issues that that are for public education, you know?
Yeah. So some statistics I can provide with increasing nutrition security. So in Erie County, 38.5% of residents are considered to be food insecure, and that's known to being low income and having low access to food. So in Erie County, there are 28 food deserts. So that's between neighborhoods and communities that do not have readily available access to food stores that offer a variety of healthy and affordable foods. So it's another focus of mine being a community impact manager. So that can look like obviously giving out questionnaires to the public to see, are you someone who would be food insecure? And if so, here is places that you could go to, like a Second Harvest Bank, WIC, SNAP, to be able to supply you with that nutritious food until your next payday. And then, it can also affect youth, right? So when they go to school, they're able to eat at school, but then when they're at home, maybe they don't have a meal at home. So then we also want to see if it's also affecting students so that we can be also able to provide them more with resources.
Yeah, it's remarkable that the food connection to heart health is right there, along with the exercise, right?
Yes, yes. So there is actually it is called so American Heart Association, it's called the Life Essentials 8, and they are the key measures for improving and maintaining cardiovascular health. So Life Essentials 8 is composed of two major areas. So one of it being health behavior. So like we said, eating better, being more physically active, not to smoke or vape, and then to get healthy sleep. So I've actually have worked with our school engagement director, and I've seen her working in schools, and she has all of these like poster boards of like these animated characters, and they talk about eating healthy as a child, right? Being more active, physically active, probably outside the gym, your gym class. Because I remember in high school, I had gym class like twice. Not smoking or vaping, and then getting healthy sleep. Unfortunately, in my previous roles, I have heard of first graders having vapes and fifth graders having vapes. And it's more so of, their older sibling is probably doing it, right? And, I'm the youngest child out of my brother and I. So if I seen him doing something, I probably wanted to do it too. So, that school engagement director, she all of them work really hard to be able to enforce that we really enforce how important it is to eat healthy. Those soda pops that growing up, I mean, the vending machines when I was in high school, I was able to get a Pepsi or a Coca-Cola, but now, water, drinking adequate enough water, being more physically active, and sleeping. I didn't understand naps until I became an adult. I love a nap.
Right.
So, but when you're a kid, you want to stay up all night and hang out with your friends, talk to your friends. So it's really important to get those health behaviors established. And then we look at health factors.
Why don't you hold that thought? We're going to take our bottom of the hour break here.
Okay.
Brandy Alexander is with us from the American Heart Association, getting a lot of good tips and focusing on the young people, which is not something that you think about with heart health, but you gotta open your mind to this. Focus on heart health here on the Joel Natale Show. Live from our Kingdom Financial Group studio here at 434. Brandy Alexander from the American Heart Association. She's the community impact manager here. And also, she's got a master's in public health. This is truly a passion of yours, the idea that, communicating to the masses best practices and things like that. Brandy, we were talking about working out. We've got to keep moving, don't we?
Yes. I was just mentioning how growing up, I was in dance classes. So if I wasn't at school, I was at dance class. And then now looking at my mom, she's actually going to dance class. Nice. So it's almost a full circle moment to see how important it is for people to be active. And it doesn't always have to be the gym,
And it doesn't have to be this drudgery, like you say, right?
Don't get me wrong. I love going to the gym because it gives me my space out of work that I can kind of release. So if I had a bad day or a good day, it's still nice to get a healthy workout in. But you can still take a walk outside, a treadmill. You can go to a dance class. There was hot yoga. I was into hot yoga for a minute.
I don't know if I'd last a minute.
You don't know that until you try. Make sure you're really hydrated for stuff like that. But no, there's other ways that people can be physically active. You guys have Ascend right across the street.
Yeah,
it's amazing. It's different things that people can do, especially in Erie. I always feel like Erie is such a small place, but it's not when you actually look at what is provided here to the community.
Can you talk about when you encounter people with limited mobility, there's still ways that they can get some cardio going, right?
Absolutely.
What would you suggest?
So suggestions, obviously I'm going to recommend seeing a physical therapist or seeing your PCP, just because every situation is kind of different, but it's also what makes you feel good too. So your physical therapist can offer different ways of being physically fit if you have some immobility, but still finding what makes you happy in that too, right? Because I hate running. Me personally, I don't like sprinting. But if I found like a song or like a music playlist to help me go through it, or if you've ever seen on the treadmills, they have like the mountains or like a beach. So I can imagine I'm not here in the gym, I'm somewhere warm. There's just different ways that you can stay physically fit. That may not be something that makes you dread it. But for anybody who has immobility, I would just always recommend talking to a physical therapist first.
That makes,
I don't want to give out a recommendation.
No. You always want to check in with your doc. But really, it's funny. People get upset. Well, all you have to ever prescribe is diet and exercise. Yeah. But really, when you think about, when we have the conversations about metabolic things like diabetes and, they all connect with high blood pressure and heart health and so on. If you can get more mobile and if you can control your diet, it all goes.
Yeah, everything plays hand in hand, right? You can't, for instance, I see it's this 80-20 rule. So it's really 80% nutrition and 20% physical, being physically active. And I think there's also a role in that of your mental health too, right? So you can eat healthy every day and you can go to the gym every day, but your mental well-being is still not up to par. So really there's 3 factors that go into, I want to say all of that contributes to high blood pressure. But again, being an American Heart Association, at least I'm learning, that every situation is different. But me personally, I can always say that there's 3 factors that play a role.
You mentioned in the first half about sleep. Can you dig into that a little bit more? Does sleep affect heart health to a significance?
Yes. So imagine if so everyone works probably about 8 hours a day on average, right? Maybe more, maybe less. But with work and then having a home life and exercising, staying fit, having friends to hang out with, if you're not getting but 4 to 6 hours of sleep, you're not giving your body much rest to be able to fully function the following day. So you want to be able, for instance, when your phone needs to turn off because it's overheating, right? You got to turn it off, let it rest. So it's the same thing with your body. You have to be able to give yourself some time to sleep. that's important. I feel like in college, especially with college students or those who are just now getting their first full-time jobs, of how overwhelming life can be in that moment. And if I think back to that, the amount of sleep I didn't give myself, I should smack my hand for it. Just because I was so preoccupied with what life was like at that time. And then now, 10 years later,
Wow.
10 years later, I'm able to say like, oh, I can't wait to go home and take a nap. Just because that adequate sleeping, it gives you a reset and a pause of what's going on, and then giving your body rest. Like, again, I work out all the time. So if I'm going to the gym, lifting weights, eating my protein, getting my fiber, my water intake, it's a busy schedule. You're going to want to be able to get some sleep after all that.
Yeah. Are there programs or support groups or, it just makes me wonder, it would be easy to feel like you're all alone in all of this,
Right. So a couple of programs. So connecting with the community, at least from my experience being here at American Heart Association and what was previously done, we've actually worked with Stairways Behavioral Health, Erie County Department of Health. We worked with JFK Center, Booker T. Washington Center, Northeast Senior Center. So there's different places, community-like settings in Erie that you could work with and enroll in a fitness class or enroll in a talk session, especially if you look at your, when you're at your PCP appointments. So I love like reading the little brochures that you see when you're at your doctor's visits, because most of the time it never pertained to me, but there's probably some information there about a support group if you are newly diagnosed with diabetes and not sure how to manage, or if you have just any kind of news that you receive that it's hard to take and you have to make lifestyle changes. There's support groups everywhere. I mean, I love social media, so I feel like social media can be your friend, not your enemy, if you use it correctly. So if you go online and look at events on Facebook of what's near you and you type in a diabetes support group, I'm sure there's tons of information that will show up. There's targeted population centers or groups, so to speak. So there's women's focused support groups. There's probably men's focused care groups. There's probably some for teenagers too. So I just feel like people have to just see, what is out there. And if you don't see something out there that you want, start it yourself. Get connected with your PCP or get connected who's in the community and say, like, I have a need and I want to connect with other people with the same needs to get the resources and information, and give Brandy Alexander from American Heart Association a call so that I can also help. But like if you don't see something in your community and you want that, do it yourself.
Yeah. Wow. Yeah. I just feel like that kind of organic approach is pretty effective, because we have these we have an obesity epidemic. We have an epidemic of hypertension here. This is not the healthiest community. We smoke too much, right? We don't work out enough. Although, boy, it seems like there's a gym that opens up every other week, right?
No, I've seen the Crunch Fitness like all over social media, and it's like I have to wait. I'm that one person. I have to wait until the hype goes down a little bit, and then I can intervene and see what it's like. But because I go to Planet Fitness, and it's completely like a ghost town in there now. Nobody is really there. Which, I mean,
is that because it's the second month of the new year that everybody kind of did their New Year's resolutions for?
It could be that 14
days
for a couple days, that 2 weeks, or it could be this is the time that I go. So I go right after work, and sometimes it pretty is busy. But I see most of like college students there, and then probably like individuals that are older than me. But before, Crunch Fitness came about, Planet Fitness used to be flooded to the point where I could not go because I could not hit every machine that I wanted to. Right. So I'm personally okay with that. But there's other Planet Fitnesses throughout Erie versus Crunch. I think there's just one right now.
So. And of course we've got
other gyms.
Gyms,
of course, tons of other gyms.
The Y and so on.
I've just always been to Planet Fitness because it's close to my house.
When is there something to strength training and heart? What are your thoughts on that?
So me personally, I believe that everything kind of plays hand in hand. So with stretching your body before working out so that it prevents injury, we want some cardiac work while you're working out to get the heart pumping. And then strength training. I mean, there's some people who don't believe in strength training in terms of like just picking up a 10 to 15 pound dumbbells versus trying to increase those weights.
Right.
So it really depends on what someone's goals are when they're in the gym. Somebody might just want to just have a nice pump, right? Like they just want to get in the gym, sweat, and then be able to go home versus somebody who has goals to increase their weight to become bigger and stronger. Because you can be, the biggest person at the gym and still be unhealthy, right? So I think it just depends on that individual's goals.
That's interesting. All right, we're kind of bringing this plane in for landing with Brandy Alexander. Make sure that we've covered all the things that you feel like, I mean, we only get Heart Month once a year, and I want to make sure it's just so important. You were mentioning that there's a difference between a heart attack and like cardiac arrest. Explain that for me.
Let me pull that up really quick because I'm going to give it straight from the American Heart Association itself. So cardiac arrest is when the heart stops beating. It is not a heart attack, but a heart attack can cause a cardiac arrest. So with this handout, I'm going to zoom up as best as I can. Cardiac arrest is an electrical problem versus a heart attack being a circulation problem. So when you have like that coronary artery block, that will play more of a role when it comes to a heart attack versus a cardiac arrest. It's the electrical component of what makes your heart beat.
So are there different ways to react to each one?
Oh, you're saying more so.
Or are you still doing the compressions for either one of them, I guess?
So what to do, of course, this document is not zooming enough for me, so it's all blurry the more I look into it. I apologize, but a cardiac arrest can be inevitable. We want you to call 911 either way.
Right.
But scroll back up. So with the cardiac arrest, that's where the AED will come into play.
Okay.
And then with the heart attack, we can do
the compressions. Yeah. Wow.
Yep, fast active can save lives. So obviously, again, what we mentioned earlier about picking that song to keep up that rhythm, because compressions take the wind out of you. I mean, I have that hands-only CPR kit, and I was trying to get the compressions just back in motion, and I was out of breath doing it on a mannequin. So I can only imagine an actual moment to give CPR, how overwhelming that could be. Working at a hospital, I've seen how people kind of like come in and out. So somebody will do compressions and there's somebody to intervene and then continue that flow. So we just recommend always calling 911 in that moment.
It's another thing, and we probably can't get into this, but you keep on hearing more and more folks dealing with this AFib. Where basically their heartbeat gets off of whack and they have to go in and re-zap them. I mean, there's just so many things that you need to learn about when it comes to heart health.
Yes. Yeah, absolutely. When we talk about even like high blood pressure, that is actually known to be the silent killer.
Wow.
So our blood pressure initiatives are really important. So that also plays a role when we talk about heart attack, heart failure, and other critical illnesses that people face. But in terms of AFib, I can't get too much into that.
Right. No, I know. But
in terms of cardiac knowledge, right? That's again where we get into, I just say your PCP is your best friend. Having a good relationship with them, your nurses, so that all that education they provide to you at your appointments, you're able to read. Of course, looking things up online, you can see some scary stuff online.
Right.
But, if you go to the right resources, the right pages, like heart.org, you'll be able to get the correct education. And then you could provide that at your next appointment and say, hey, I looked online on heart.org and I saw some things that I think pertain to my illness, pertain to my diagnosis, and I want a little bit more of information. And then they connect to people like me. We get out in the community and spread more awareness and give out more education.
Yeah, you really need to know. You need to be aware of your symptoms. You need to be aware of your numbers. I mean, I'm not sure. Again, we talk about hypertension. How many people know what
well,
their regular numbers are?
So that actually gets into something that we call the self-monitoring blood pressure program. So how that can look, well, from me standpoint, it would be I would work with a community or clinical like setting, and that we would be able to get a loaner program. So let's say, for instance, you're a patient and you have high blood pressure and you want to know what your readings are at home or, on the go. You'd be able to loan out a blood pressure cuff and then be able to take it out at home before medication, after you take your medication, when you wake up, go to sleep, you have it at home. Wow. So it's really at your luxury of when you like to do it. So for instance, my family, we're known to have hypertension, and my grandmother has a blood pressure cuff. My mother has a blood pressure cuff, and I see them all the time getting their readings, and they'll ask me like, hey, Brady, my blood pressure was 160 over 90. How's that? Like, it's okay, but right. Did you take your medication? So it gives you that insight of what your blood pressure is like at home versus like at your appointment. Because sometimes, if at your appointment, if you have some blood work to get done, or you may not get the best news, your blood pressure would be.
I was gonna say you have the white coat syndrome, right?
Yeah. So me personally, I tell my loved ones to ask for a blood pressure reading at the end of the appointment. So after they tell you whatever you need to know, or you get your blood work done, because I do feel at ease when I know I'm walking out that door. But
that's a great tip.
Yeah, I know that if I get my blood pressure read and it's higher than what it usually is, I'll say, okay, once we're done today, can I get my blood pressure read again? And then 9 times out of 10, it's way lower. It's just because I'm like, oh, I gotta get blood work, or oh, I gotta do this today, or my so I always recommend that. And then again, if that's somebody who's short on time, they can go home and have that loaner blood pressure cuff and check it there.
You just had a wealth of information. We really appreciate it. Brandy Alexander, how do people get a hold of you if they want to learn more, or maybe, plug into one of your situations?
So I will
there?
give you have my email already, but my phone number is on there as well. So email is probably just as best.
Yeah.
But yeah, contact me on my email, and then obviously heart.org if there's information on there. You can find about Erie County's information, and it'll get back to me that way as well. But yep, the email, brandy.alexander@heart.org. And I would love to get connected with more people in the community, hear out what their needs are, and try to get them connected so we can keep evolving and keep being great.
Yeah, I mean, again, it could be your little social circles or your bowling league or whatever.
I was at Penn State Barron, and a gentleman came up to me about his wife, and she's like in some club, women's club, and he was like, I would love for to connect with them, and I'm like, yeah, like that. Those are the type of opportunities that someone like me wants to get connected with. So those community-like settings, whether it's a gardening club and you guys want an AED, because obviously working outside, that could be harmful to some people with having a heart attack or, shoveling outside, things like that. But getting connected with people in the community and them expressing their needs of what they see and how they can become greater, that's where I want to interact, who I want to interact with.
Brandy Alexander from the American Heart Association, thank you so much for taking the time.
Yeah, thank you for having me.